Imagine you're trying to focus on a cold book or a fun game, but suddenly you hear someone nearby doing this or doing this. For most people, that sound is just a little bit annoying. But for someone with our next psychiatric word of the week, that tiny sound feels like a giant alarm bell going off in your brain. Our psychiatric word for this week is misophonia. The word misophonia actually means hatred of sound, but it's not just being grumpy. It's just that the person has decreased tolerance to certain noises. If you have misophonia, certain sounds, which are also called triggers, don't just sound loud. They feel like an emerging sound. Everyone is different, right? But these are some of the trigger sounds that can bother people with misophonia. Chewing, crunching, swallowing, slurping, heavy breathing, throat clearing, sniffing, keyboard typing, pen clicking, tapping on the table. All of these sounds can make the person have immediate emotional reaction like anger, disgust, anxiety. They can have autonomic arousal with increased heart rate, muscle tension. They lose focus. They have the urge to escape or stop that sound. Their insight is often preserved because the person knows that the reaction is excessive. Now, why does this happen? It's still being studied, but the scientists think that the part of the brain that handles emotion, which is the amygdala, gets kind of confused. It may also be due to an abnormal connectivity between the auditory cortex and the limbic system, which is like the place of emotional processing. So the brain hears a normal sound like that crunch and accidentally sends out a dangerous signal to the rest of the body. It's like a smoke detector going off just because someone is making toast. Bruh. It is not classified as a formal DSM-5 diagnosis, so that we should know. How can we help people with misophonia? How can we help? If you have a friend or a family member with misophonia, remember that they are not trying to be mean. Their brain is just being extra sensitive. They might wear headphones, they might use earplugs, or sometimes they need to eat in a different room to stay calm. Psychoeducation is very important. You can also do cognitive behavioral therapy, CBT, you can do sound therapy, or some environmental modification, and also stress reduction techniques. When you hear misophonia, now you know what that means. Follow me for more psychiatric word of the week. Until next time, stay mentally aware. Bye.